Hey guys, I'm decided carrying in the context of traditional Chinese culture. We're going to look at some background information before we go into specifics about different populations of patients. So China is the most populous country with 1.355 billion people. That's roughly 20% of the world's population. In context, India is second, United States is third. 4 million people identified themselves as Chinese in the United States in the 2010 census. This can be Chinese immigrants, first generation Americans, anyone who identifies as Chinese. 71,738 people immigrated from the People's Republic of China to the United States in 2013, putting China second behind Mexico for immigration. The population of Chinese Americans is growing, so we as nurses need to understand what traditional Chinese culture values in healthcare and what their beliefs are. Chinese culture is more than 5,000 years old. Traditional Chinese culture emphasizes respect of the social hierarchy, society, and the elders. The culture values family and society over the individual. The individuals place second, most of the time last, promoting this harmony of society and the family. Chinese culture is very heavily influenced by Buddhism, Confucianism, and Taoism. Gender roles of traditional Chinese culture are similar to those of traditional European culture, where the men are seen as the most important, women second, children last. Traditionally, men are seen as the head of the family with the responsibility to provide for the family. The men are the head, women take care of the household day to day. Traditional Chinese families are extended. The elders will live with the oldest male child, so the grandmother may be responsible for the house by way of her daughter-in-law. So some Chinese language. Mandarin is the most widely spoken language in China and is the official language in Taiwan and the People's Republic of China. Mandarin is taught in all schools, so even those that speak one of the other multitude of dialects or languages understand some Mandarin. Cantonese is the second major language spoken in China. We need to keep this in mind. Just because we have a patient that identifies as Chinese, it does not mean they speak Mandarin, may not even speak Cantonese. It's very important to figure out which dialect they speak. That's why it's important to have a translator. When talking with elders, and we're going into interpersonal communication now, we avoid direct eye contact. It's seen as very disrespectful. When you're speaking with your patient, they might not look at you, and you staring at them could offend them. It's seen more as a confrontation than understanding. Eye contact between those of the opposite sex is seen as flirting. Touching is uncommon in Chinese culture, though touching by a healthcare professional is appropriate. It's expected that you'll tell them when, where, and why. Shaking hands has become and is becoming more popular, more acceptable, I should say, though the older Chinese may still give a nod. Less common is a slight bow. Bowing is more appropriate from Japanese culture, some Korean culture. You won't see bowing as much as in China. Shaking hands is seen as acceptable when meeting someone. Like I was saying, silence is used to convey agreement, disagreement, or lack of understanding. A lot goes on in that silence. A lot of Chinese communication is indirect, going back to not wanting to upset anyone, having harmony in society and in the home. So when you hear that silence, we need to focus more on direct questions, more open-ended questions, so it gives them a chance to explain to us what they're saying, what they're trying to convey. So the health beliefs, Chinese Americans use a combination of traditional Chinese medicine and conventional Western medicine. Chinese medicine's more holistic, conventional Western trending that way, but it's what we practice. Sometimes they utilize herbalists, acupuncturists. You have cupping going on, teas, and coining. Cupping, you heat up glass cups, place it on the body, it pulls the blood to the top. Coining, it's abrading the skin with coins, again bringing blood to the skin surface. Traditional Chinese medicine is based on the concept of yin and yang, which are forces of nature, and they're balanced to produce harmony. All things derive from the same origin, and that humans were born of the vital qi between heaven and earth, hence we should follow the natural four seasons laws to grow properly. Again, yin yang, qi flowing in balance through everything. Keep everything in balance and you'll be healthy, is their thought. Western medicine may be used only when traditional remedies have failed for severe symptoms, This may lead to a late diagnosis and the use of the emergency room by Chinese immigrants. Typically, they don't engage in health maintenance the way we think of health maintenance, but they do focus on balancing their yin and yang, the hot and cold. Back to yin and yang really quick. Hot and cold, male, female, dichotomy there. It's usually just with the circle with the black and white. The grandmother or the eldest female member of the family provides advice on prenatal care, and during childbirth it's considered shameful to scream or cry out. After birth, warm foods are preferred, and again it's based on the balance of yin and yang and pregnancy causing heat to be lost from the body. So when we offer them ice water, they're probably going to refuse because they don't want to take anything warm. They may not have anything warm for a month after the cold, after the baby's born. Female members of the family are probably going to be present during the birthing process, which is unusual for us. If the father's present, they do cover the mother's private parts. And the birth of a male child, as we said before, is more favorable than a female child. The mother will defer to her husband or older family members over how to care for the baby, breastfeed, formula feed. Care of children. Nurses, remember that the theories of development are based on observation of Western children and might not be applicable to children of Chinese descent. Chinese children's teeth erupt sooner than Hispanic or Anglo-Saxon children's. Male children are expected to have control over their emotions, and absolutely under no circumstances are you to ever cry in public. Female children, the same is expected of them. Nurses should remember that children are fed separate from adults. Children eat after adults, typically, so it's not unusual to have a family eat, the child in the hospital bed not eating until afterwards. And if the child is NPO, the family may still eat in front of them. And again, parents may defer to their elders for consent for treatments. Your patient will probably have tried TCM before they come to you. So you're probably going to need to ask, what have you tried? What do you call your problem? That's going to help you focus on the actual problem when you have those language and cultural barriers in place. If the treatments of traditional Chinese medicine are beneficial or neutral, integrate them into the treatment. It builds a bridge, shows them that you respect their culture and the medicine that they've been using. If it's negative, explain why it's negative and how what you're doing is going to help restore balance. It wouldn't be out of the question to consult a traditional Chinese medicine doctor just to get his input. They are trained with some Western training, so they do respect Western medicine, they just have a different way of going about it. Emotional self-control is very important, so they may not admit to any pain at all. Very stoic, harmony, don't upset anybody. And when you present a pain scale, Chinese is written top to bottom, left to right. So our pain scales that are going, I'm sorry, Chinese is right to left, top to bottom. When we present our pain scale, we don't need to use the left to right scale. We need to use a 1 on top, 10 on the bottom, or vertical scales. Some Chinese patients can't even convert codeine into the morphine-like metabolites, so they don't get pain control, they just get upset stomachs. That's important to know and to remember so you can look at those other indicators of pain, their vital signs, how they're acting. Older Chinese live with the family, like I said earlier. Filial piety is expected of the family to take care of their elders, and elders will expect you to use some traditional Chinese medicine to treat them, so here consulting a traditional Chinese medicine doctor would be very beneficial. They may refuse to be placed in an extended care facility because they are leaving their family. It's different from what's expected, but if it's pressed, they will, knowing that this is going to promote harmony. They have a high degree of fatalism and don't understand why planning for death is going to help. I'm going to die anyway, and they perceive that just by talking about it, you may have an earlier death. Something else very important, older Chinese patients will expect the diagnosis to be told to the oldest male child, and they'll decide what to do about it. So in communities, you need to see if there's a community center or a group that meets in your area. Get with them, see if you can present topics about maintenance. If you're lucky enough to have a bilingual, bicultural community liaison in your facility, use them to help build those bridges. Remember to comply with cultural norms and expectations when you're interacting with the people in the Chinese community. And respect and trust results from culture becoming meaningful to healthcare when it is analyzed and interpreted within the individual patient's social and historical situation. Understand they're doing what they've always done. This is how they've taken care of themselves. Respect that. Explore what may be preventing them from seeking preventative health care and explore those solutions. 14% of Asian American families live below the poverty line. And in context, 10 to 12% of Caucasian families do. So, Chinese culture, remember to be respectful of. They may shake hands, may not, may just nod or slightly bow. Little or no eye contact. Remember about the silence, conferring consent or disagreement. Ask open-ended questions. If possible, use a same-sex nurse and doctors, and if you're going to touch them, say when and why. When it comes to family and age, remember patients going to refer to elders, women to men, may refuse or delay treatment if they think it will preserve the family harmony. So that's when you talk to the older family members and explain why. And older patients expect the bad news or prognosis to be given to the oldest male child. Traditional Chinese medicine may have been utilized, so don't disparage it. Look how it can complement the treatments, building bridges again. Ask what they have tried to treat the illness, know the treatments that are harmful, less harmful, coining when you're using heparin, not a good idea. If the patient's wearing an amulet, which some do, don't remove it unless you ask for them and get consent. General considerations inform the information in our facilities are usually only in English and Spanish. Think about that. See if you can get them translated through Word or something into Chinese. But also keep in mind that Mandarin may not be their primary language. A lot of them do not have insurance because they don't understand how it works because in China it's provided for you. They may need help obtaining insurance and understanding our system of healthcare, and different elements are either yin cold or yang warm, so you need to keep that in mind and ask them what this disease or ailment is considered and provide foods that comply with that. I hope that this has been helpful for you guys. Have a lot of links here